Hello everyone, my name is Jenny. I'm going to tell you my program, which is based on my thesis. And the purpose of why I want to do this thesis is for the cognitive functions in hemodialysis patients. The reason is really important because the prevalence of cognitive impairments in hemodialysis patients is really high, which are highly related to death rate and increase their days in the hospital and also lower mobility and will cause like low quality of life, which is really bad. And currently, there's no effective drugs can help them solve and improve their cognitive functions. And during this program, I plan to focus on two interventions. The first one is cognitive training, and second one is exercise training. Do you guys know what is cognitive training? Okay, no one know. Cognitive training is like use your iPad or maybe the iPad will just provide to you and doing some games like brain develop games to improve your cognitive function. And exercise training is for like people doing exercise at home or maybe during hemodialysis, which is like riding bikes or maybe walking, but just supervised from clinicians or nurse. Yes, and they will just teach you how to do this. So that's called exercise training. So my program objective is really specific populations is for hemodialysis patients. Now I'm going to tell you about PICO. PICO is a method which is means like patients intervention, comparisons and outcome. So my patients is hemodialysis patients. Intervention is like patients doing cognitive training alone or exercise training alone or the combinations of these two. And so comparisons is like in addition to above interventions or people do no treatment, which is like usual care, I will just include in my program. And outcomes is related to cognitive functions, which is like qualitative and quantitative data, or maybe mixed method data. Related to cognitive functions, I will all include in my study. So the excludes criteria, which is really clear, is like if the sample size is overlapped, I will just not use that. So my plan is to like use an integrative review, including qualitative, quantitative, and mixed methods research, thereby provide a comprehensive understanding of my research topic. So my research strategies is to research on like 6 electronic databases, which is really, really popular. Maybe you guys don't know, but like it's just really popular in nursing fields, including Scopus, PubMed, Web of Science, Embase, Cochrane's, and Clinical. I'll choose this 6 and to like search lots of articles so I can just give you guys really complete outcomes and also clinicians can guide them. So if the study is just completed and will just confirms the effectiveness of exercise training or cognitive training of the combinations of these two will like enhance the cognitive functions of hemodialysis patients. And it could enable clinicians to develop evidence-based guideline and design effective interventions. Consequently, they will just really helpful for the patients reduce their high mortality rate and other adverse outcomes. Moreover, they can improve their quality of life. So this is my program. Do you guys have any questions? Okay, the hemodialysis patients is like people have like CKD. CKD is like chronic kidney disease, which is like the last period, so it's the worst period. So people will just choose to like use the dialysis, and this is the one of the the cure. So people can choose like hemodialysis, which is like use a machine to help them solve their kidney problem to release their poison. So yes, this is hemodialysis. Yes, do you guys clear about my topic? All good. Thank you. See you next time.